if you are younger and you want to grow in your career in biopharma or technology, it is very important that you believe in possibilities and believe that, it's going to happen. So because what happens is that we think that we attract what we want, but we attract who we are. So we never attract what we want.
That's good.
Yes. Yeah. Emotional intelligence is still one place or area where I think it will always remain unique to a human. But just I think all these things, which is self-awareness, self-regulation and empathy, could actually change how we show up in our relationships, our partnerships, our friendships, and at work, and again, what we do.
Hey, y'all. Welcome back to Through with a Splash of Tea, a podcast where conversation is key. I'm your host, Cass, and let's get right into it. So today, our guest is a true trailblazer in the biopharma and digital technology space, Miss Nishtha Jain. With over 15 years of global experience, Nishtha has been at the forefront of digital technology and transformations, digital product development, and digital innovation strategies. Currently, as the head of innovation and digital technology at Takeda Pharmaceuticals, Nishtha is revolutionizing global research and development quality through cutting-edge digital and data initiatives. Beyond her work at Takeda, Nishtha is an advocate for diversity, equity, and inclusion in the workspace, serving as president of the Mid-Atlantic chapter of the Healthcare Business Women's Association. Today, we'll deep dive into Nishtha's journey, the innovations shaping the future of healthcare, and her insights into leadership and digital transformation. But first, as always, thank you, Nishtha, for being here.
Thank you, Cass. It's such an honor and pleasure to be here.
Yes, and I'm really, really excited to hear your story. We're gonna dive into everything. Okay, so first things first, can you tell us a little about the key moments or decisions that shaped your journey and your leadership role in said journey, but also some significant changes you've been able to view over your 15 years of being in the industry?
Sure. That's such an amazing question. I think what I would start with is, when I think about my work in biopharma and technology, I feel deeply grateful, curious and energized about the future. And as you can see, I'm an innovator. I'm very futuristic, strategic in nature. But to understand, why this happens, I want to go back and reflect onto my journey and sort of those decision points that led me to where I am today. So growing up in India, I was expected to follow a very traditional path, which all Indian parents in well-meaning way put on their kids, which is, you should be a doctor. and that was exactly, what I was put into, not knowing if that was the right path. So since I've grown up, that's what I always heard, that you should be a doctor. So my parents instilled in me passion for science, and that, science should be used to heal people and to find the right medicines. And so that was always there. But then it was a very, very long and grueling process for me to go through the entrance exams in India for medical school. And just to give you a perspective, there are 200 seats for which million of students apply.
Oh my goodness. There's only 200 seats in order to become a doctor, in order to get into schooling for it?
Yeah, so essentially in India, and again, it might have changed from back in the day, but then every city, so I come from the capital of India, New Delhi. So in New Delhi school, there were only 200 medical seats by, a government college. And for that, there are millions of kids who would apply because, population of India is so huge. So it was very, very competitive landscape where I was. And then the interesting thing is how in the United States, you could go to Caribbean or you could go to a different state. But in India, the city you live in, that's where you can go to the school. So I could not apply to any other city medical schools because I wouldn't qualify. So they look for something called as domicile, which is your, state or zip code where you live. So it has to be within that city. So my option was too small. I attempted twice. So both the times I did got a decent rank, which was somewhere between 400 to 1,000. It wasn't, and I don't even remember exact rank, but it wasn't in the first top 200. So what happens is then you get offered to go into a dental school. And so because then what happens is different dental schools come and they say, oh, you are still talented. We want to take you. But for me, I was like, dentist is not the same as doctor. And nothing against the dentist out there. But I was, so that was the turning point where, again, going through that long process, I found myself in this cycle of struggle and pressure. And then there came a moment where I made the first choice that, again, I don't want to do this anymore. So that was very tough for me to say. And, giving the exam one time and then 1 year doing nothing but just preparing for the exam and giving it again, I finally got the courage to say, I don't want to do this. And even though it was something I've always had been embedded in my DNA. So then again, I had this love for science. Now, what was happening was technology was picking up again. Smartphones were just coming. Internet was still a new, not very new, but, an interesting thing being a millennial. So what I saw was an opportunity, which, again, I think it has proven to us now that biotechnology was a very, very emerging field back in the day. So the possibility I could see was that how about if I bring this science and study technology together? So what would the convergence of that look like? So that's where I decided to pursue biotechnology instead, of actually going the traditional medicine route. And it was a very powerful decision, I think, because that's where I think that innovation comes in, that I could see that in future, the combination of both at intersection of how you could improve patients' health would be probably the future.
That's amazing.
Yeah.
Oh my goodness. What I want to dive into real quick, what your parents' thought process when you mentioned to them, hey, I'm going this biotech route. What do you think? Is that enough? Is that doctory enough? Or how did they react?
So they were very empathetic because they felt like I tried my best and I did, because I still got a decent rank. So I think by then they had made up their mind that it's okay to, for her to pursue whichever career she choose. But then I think so that was my one decision point. But then there came a bigger decision point after that where I did an engineering degree from India in biotechnology. But then I said, how do I take this further? So that was the other moment where I actually had I was working as a software engineer at Accenture, but I made this second big decision where I said, I do not want to only work in technology, but that passion for healthcare science has to be there. So I decided to immigrate to United States.
Okay. At what age did you come to the U.S.?
So I came to the U.S. at age of 22.
I know that was tough.
Yeah. And I've never lived outside of my house. So this was the first time coming to, to a school. And I went to Georgetown University. So I lived in Georgetown area, actually, which honestly was such a beautiful area to live in. I could walk to my school. So that was another big decision that I took. And at that point, I still did not see, I was like, this is still very new. There was not much talk about biotechnology even back in the day. And this is like 2011 is when I came to do the master's. And then we have seen in 2020, right, how biotechnology suddenly became a very hot place to be in. And now it's all biotechs are what is innovating even big pharma. So essentially, it was that place that you had to kind of just wait and watch. But I could see that's going to happen later on, so I think this is the career part. But then I think in life, for me, there was also a very pivotal moment where I actually had I had to go through a painful divorce. So, things did not, and this was in early 20s, in my early 20s, and then a depression followed because of that. So it was also very early in my life that I established importance of mental health and how that our work life and our personal life has to be something we have to balance. Because if we burn out, or if we don't respect our body and our mind and our souls, then that is not gonna work in long term. So, but I'm glad that because of that experience, I learned that very early in my life. So then what I did is I traveled a lot, and I explored different cultures, and to understand life from different angles. And that sort of helped me heal my depression and sort of have a very different perspective of what my path could be in future. So that's one of the I would say, like, a bunch of big decisions that I took. But then for specifically about how I landed in my role is I had to, again, take another big risky decision, which was moving to Boston. So when I was offered a job at my previous company, Biogen, which is a biotech, I could clearly see this is have been something I wanted to do. But then I was pretty well established back in Pennsylvania. I had a great friend circle. I had great social circle. But then I had to take that risk, make that pivot. And I told myself it's going to be a 5-year plan. So it's already been 3 years so far. And it has worked out really well, because if I wouldn't have moved to Boston, this opportunity wouldn't have happened. So ultimately, it led me to that role. And then finally, I was able to get this role. And now whenever in my current role at Takeda, whenever I'm making any decision every day, so what I ask myself is, does this help people? So that's at the core of where, I try to think of things.
That's so good. Because it always goes back to like your core value. Like my goal is always to help people. So I'm constantly asking myself, with these new projects, with this new gig, with this new, am I still aligning with my core value?
Yeah.
That's really good.
Yeah. So it's a bunch of decisions, but every decision very unique, very different. But I think it's sort of trying to take the risks, but not worrying about what the outcome would be. And I would also say that my journey from stepping away from an expected path to rebuilding my life through these decisions, self-discovery, again, every day reminds me that, the choices we make not only influence our career, but also our personal lives. And I've learned that choice is contagious. When we lead with clarity and courage, we light the path for others. And that's what I think I do. I bring purpose to technology, possibility to problems, and choices to people who need it the most.
That's exactly what you do. You stated that perfectly. You stated that so perfectly. With the intersection of technology and the pharmaceutical industry, like, you are paving a new path for people to really understand themselves and understand where we need to go. Oh, that's amazing. And you can tell, listening to it, I can hear your passion for it, which I like. I like that. Because people can say they're passionate, but they're not really. But I can hear it.
Thank you.
Oh, that's so good. Okay, let's go into AI and the growth and the technology, which is beautiful. We've seen in our lifetime, we've seen AI like skyrocket, or technology as a whole skyrocket. So let's talk about AI for a second, and machine learning. So I want to ask how you see that shaping our future when it comes to biotech, as well as I want you to throw in there in that story some of the barriers that you either have experienced in the past or that you foresee maybe that we will hit in the future.
Yeah. So so just to answer that, I think what I want to start with is just a little bit to share how a biopharma value chain works. So again, building manufacturing a drug or developing a drug is so different than developing, say, a toothpaste. So in toothpaste, we could come up with that quickly, and then there can be iterations of that in taste, flavor. But when you are developing a drug, it can actually cost about a $2 billion, and sometimes between $2 to $4 billion for a pharma company. And it's divided into various phases where there is some discovery or preclinical work. Then there are clinical trials which go over for the 5 or 6 years, and then there is commercialization of drug. And all this happens after FDA approves it at every stage. Now, when I come back really quickly to the drug discovery, so that's where the major spend right now is for pharma, because what happens is to identify the right drug molecules from all the existing possible molecules and the right combination is where, so just to explain it a little better is, suppose I found a molecule and the combination is there, but as I started moving forward, it got rejected in one of the clinical trials, or it didn't work good. Then what's going to happen is I'll have to restart all over again. And from that point to already clinical trial, I've spent multiple years doing that. So now think of AI. So what AI can do is it can actually scan all this data at a very, very fast pace. So all the possible molecule combinations, all the, possibility of which could be the right drug component. And not only that, but what could be its efficacy, what could be some of the side effects, some of the information that, we would initially not have deciphered otherwise. So it helps in that. So that's where AI can, change the game. Again, there's a lot of work being done. And according to my research, there are a bunch of companies and mostly biotechs in the USA that have used that in successfully. And actually, there is one molecule or two, not many right now, that were developed through AI. And so far, I think clinical trial 2 is where they have reached so far. So think of that could save so much money and so much time. So I know, and then clinical trials can be run faster with AI by recruiting patients faster, analyzing their data faster, getting the results faster, matching them to the right trials, going over their whole profile information. So again, that's all clinical trials. It could impact different stages, but then it's after even clinical trials now, commercialization, medical affairs, where AI can help in ensuring you could identify the right physicians who would be able to prescribe the drug, give them the right knowledge, and then in commercialization, there are again a humongous application, just how in any other commercial company, AI can really, really play a huge role. So even though AI is pretty much every stage of drug development, it could make an impact. I personally am biased to that initial phase, because if we didn't start right, then we'll have to go back and start all over again.
That's amazing. I didn't even realize, I knew AI was expanding and growing the medical field like that, but I didn't realize how much time, the amount of time, years.
Yes.
It saves us. Wow, that's amazing.
Yeah. And then I know you also asked about some of the, challenges. So I would probably say more like adoption challenges or challenges to bring in AI. So pharma tends to be a very regulated industry. And because of these regulations, and I think that's the number one challenge that I would say is there, that we have to ensure that the way we are bringing in AI technology, it meets all those criteria. So I think that's number one challenge. Now, in addition to that, again, I always tell this to people: technology is not about technology. Technology is about people. So people have to be ready in an organization to embrace that change, and that has to really, again, if I am told by the upper management or the CEO of my company that I have to use this tool, that's when I will use it, right? So I think it's like top-down approach, bottom-up approach. So that all has to come in, but it's the digital, it's the mindset. So I have to be ready to embrace the technology, because one step is, even if I get the bottom-down, top-up approach and I have, I implemented a tool, now the tool is there, but nobody wants to use it. So I think that's where I think there is a narrative now where people have to start thinking about. And again, I if you like it, if you don't like it, but AI is going to change our jobs and our roles. Again, some of them it is likely going to replace, which again, I don't know what those roles are, how that would work, but there will be every person, the way we work, the way we do our day-to-day job is going to change. And AI is changing it already, as we could see. So the best way is to actually, open up your mind and say, let's list down all the things I do, and then actually see what are the things that AI could do better. Because what that would do is it would save that time by giving those, outsourcing those tasks to AI, and then using the rest of the time to actually build your skills so you can have a job in future.
Yes.
Yeah.
I think that's a lot of the negative connotation when it comes to AI, because it's like, I don't want to adapt myself to this new system that's going to take my job. But you don't have to look at it like this. This system can help you get more time back to fulfill your job in elements where only a human can. Exactly. And there are elements in most jobs where you need a human brain. You need an outlook on the world that AI can't offer you. So it's not necessarily here to take your job, but how can it help you be better at your job?
Exactly. And like it or not, but just this week, so the most recent development in AI has been Shopify, is one of the company we all know about. So Shopify's CEO already announced in the company, and again, I think it was announced and it was leaked on social media, but he said, evaluate all the roles that AI can do and then only open a new headcount. So he's already asking people to look into what jobs can be done by AI and not actually open any roles for anything that AI could do.
Yeah. So it's already happening. It's already taking over so much, which again scares people.
Yes.
But it doesn't have to scare you.
Yes.
Fold into it. If this is the direction we're going anyways, then just walk towards it and figure out how you can make yourself more valuable. I guess that's nerve-wracking though. Let's touch base on ROI for a moment. How do you ensure that your return on investment is still going on the up and up and still going in the right direction?
Yeah, so it's a very, very interesting topic. Again, as we bring in AI, there is a lot of buzz. There's a lot of questions around. I'm bringing in this. And again, all these technologies are a little expensive to bring in and even experiment with them. So people keep asking this, what is the ROI? How can I get it? So the way I approach the ROI, and I would like to share a framework here, is that ROI is not just ROI. Like, I think it has three different buckets where it is return on employee experience, so ROE. Then there is return on finance, which is like actual dollar coming back through, an investment. And then there is return on future, which is how you could plan the future. So now when I think about the first two, which is the return on employee experience, is where I would think 70-20. And then, so this is the ROI framework. And now how to apply this could be a 70-20-10. So 70%, a company could actually invest in the return on employee experience, or they could flip it and do 20% in employee return on employee experience. What that would do is it would help employee learn AI, get trained on it, also leverage it for generating day-to-day efficiencies on how they do the work. And it would, help you retain them in long term. So I think it's very, very important to think of that as a factor, because not every tool you build can give you the ROF, which is the return on finance. So a lot of tools that you're going to build are only going to make things easier. They are still generating value. So I'm not saying here, don't look for the value. Look for the value. But then I think the tangible main KPI should be return on employee experience. So that's number one, return on employee experience. Now, return on finance, it could be either 20% or 70% based on where your company is at. But then return on finance would be those technologies and tools where once you put them out, you're getting money back from them, or you're generating income back from them. And that's where your profit could come in, or essentially, that's where you are generating the real sort of what traditionally we call ROI. So that's, ROF. Oh, and then the other ROF, which is return on future, is literally that 10% money. So which you could use and just say, use it or lose it. So again, work on, moonshot technologies, moonshot ideas. And if that money comes back, great. If it doesn't come back, I mean, every company has at least 10% in even travel budgets. So it's easily explainable. So again, just wanted to repeat, somebody struggling with figuring out how to, justify to their company, I want to experiment with AI, but how do I apply it? A rule of, breaking ROI into 3 buckets, which is return on employee experience, return on investment, which is return on finance, and return on future. And then applying the 70-20-10 model that could really help in justifying it to your management.
Did you come up with that? Those 3? How did you?
So I think this is based on Gartner research. So Gartner, which is a very, everybody knows them. So that's the model that they came up with. But it's, I came up with 70-20-10, which I have applied and it has really worked. But then if we bucket these items into the 70-20-10, that's, boom, it works really well.
That's so good.
Yeah.
Those 3 buckets are perfect.
Yeah.
Because when you think of ROI, typically you'll think of, okay, how are you making my money grow? How are you making this business money grow? But a business is so much bigger than its money.
Exactly.
Your employees are, that's what you have. That's who's running it, who's fueling it.
Yeah.
And then we do have to take a look at the money. Like what money are we growing? Like, are we growing this money? And then finally, what does this look like in the future? How do we ensure?
Yeah. And then this is, only specific, I would say, to digital technologies or AI, or if you are in a role where you are asked to, experiment with different tools and determine how to make decisions. You have a big budget and now you don't know how I should invest it in technology. So this is, I would say, how you could invest in technology, simply 70-20-10, and, you can adjust. But I do encourage that people should think of that 10% too. Because if you don't think of that 10%, then, how will you innovate?
Yes.
Yeah.
Now I know why people like that response yesterday. They loved that one. That was really good. So let's hop into diversity and inclusion, because those are big. That's big for you. And first things first, I want to know why it's important to you. And then I want to transition into how it's played a role in driving you into the position you are today and continue to fuel you.
Sure. So I personally feel, and being an immigrant in the United States and being a woman of color, I have always valued diversity, equity, and inclusion as again, very, very important for me, even making any career choices, or when I, am looking for a prospective employer. That has been, something that has been very important to me. And why it is important? I immigrated, I'm women of color. Initially, there was always a moment or a point where I kept thinking, where do I belong? So there was I looked for my belonging for a really long time, until I find one of the women leadership groups which is an employee resource group. So all the Fortune 500, Fortune 100, and even mid-sized companies have these various employee resource groups, which are essentially created to support a minority group or an idea. And again, I personally feel it should be embedded in the business model of most of the companies, but I did not find my belonging until I found one of those. So one place was that I found it in an employee resource group at my company, where I joined this women leadership initiative, and I attended 1 or 2 of their events, and then very quickly I was on the other side arranging events where I would bring speakers who would help women think differently. And I'm sure you must have heard this, but if a man wants a job, he'll just go for it, and he'll quickly scan through, oh, these are the requirements. Okay, I qualify for the job.
I'm great at this.
So I'm going to do it. But then for a women, they'll look at the job description, and if there's one thing that is not what they qualify for, they'll say, I'm not going to apply for the job. And it's a very common thing. So that was where, I try to change that for women. I try to bring various speakers and launch various programs where they could have the tools and resources to know that. And that's what I got initially from those ERGs. And then I joined an organization called as Healthcare Business Women Association, which is a global organization now, expanding like fire, doing really, really well. So I have been member of that since 2016 now, which, almost coming to a decade. But I got all of those tools from there. And what I did is I said, immediately after attending a couple of events, I said, I want to host and organize these events. And I became a member of that. And I continued my journey with them so far. But it gave me a sense of belonging. It helped me, understand the value of my skills, but also, as an immigrant woman of color, it just gave me tools and the right, like, sort of belonging, the forum to exist.
That's so good.
Yeah.
It's so important for us to not only like break barriers and enter new industries, but also to be the catalyst and keep the door open for other women that look like us or other people that look like us in order to bring them into those spaces as well. So I think that's so great that you do that. What can organizations implement in order to increase their diversity and their inclusion in their companies? What do you think?
Yeah. So again, as I mentioned, Fortune 500, Fortune 100 mostly have employee resource group. Recently, I don't know now how many of them are keeping that, but what organizations can do is they can think about this at the leadership accountability level or at the leadership commitment level. So again, I love the rule of three, so I'm just gonna share three things here. Leadership commitment and accountability. So what companies could do is they could create a goal around these factors, or they could say that this is embedded in our leadership principles at a company where, again, if a leader is not acting according to these pillars, then there will be consequences. So which could allow, companies, everybody trying to get the work done to follow certain, basic principles and ensure, they are creating inclusive teams, they are hiring diverse candidates, and they are giving people opportunities. I think that's all it is about, So that's number one. I feel very grateful. I'm at Takeda. Takeda does it at that level. So everyone, our leadership principles sort of, it is embedded as a part of that. So if somebody doesn't appear inclusive, they're quickly told that that's an unacceptable behavior as a leader. So again, I love that about Takeda. I think number two is the transparency in DE&I actions. So anything I think these companies are doing, they could be transparent about, what their spending is or what they want to do, but then opportunity to create these ERGs. So the companies who don't have these ERGs can create some of them. And again, I don't want to name a lot, but then there are Asian ERGs, there are, women in leadership ERG. There is also veteran ERG. So sometimes they officially want all the veterans, who have served our country to be able to connect with like-minded people or find those people there and help and provide them with the right resources to be able to grow. So just some examples of ERGs, but I think that could be another thing that the companies could consider. And at the end of it, accountability, where how they can have some metrics coming out of these initiatives, which again talks about and it could be shared in the company letter that's released to the board members that this is how we are exercising DE&I. So again, it can be published as reports. So companies can be very transparent about it. And I do know at Takeda we achieved 47% of women in leadership goal last year, and actually Takeda won an award this year as well. So Takeda won multiple, different awards in different areas, but for gender parity, they won HBA ACE Award, essentially for their work to ensuring that there are 47% representation of women leaders. And again, I might be a little bit off in that number because it might have reached 50 by now, but I think we are like just close by. We are there.
That's amazing. 47%. That's so good. Okay, so I have one more DE&I question that I want to ask. Okay, so other than the fact that it's your story, that's your story, literally.
Yes.
Other than that fact, why is it important for companies to prioritize or even think about diversity, equity, and inclusion? Why is that important? And how can that contribute to a company's growth, whether it be the workforce, whether it be what they develop? Why is it important? Why does it matter?
Yeah, so I here want to share maybe, again, 3 things, but then with some data. So according to Harvard Business Review, companies who have broad range of perspectives or hire diverse individuals actually have 60% better rate of success because what it helps in doing is it helps in bringing different viewpoints and different stories. So just like how my story is so different, from maybe your story and other people on the team. So the more diversity we have, the better, there will be perspectives. And again, there will be better problem solving because there will be better questions that would come out. There will be, just, I would say like different cultures, how certain things are great in a culture, but not in the other culture. So maybe more risk-taking. But again, better solutions to a lot of various problems that could come out of it. And it can promote out-of-box thinking. So that's one reason, which is broad range of perspectives. The other could be creativity and innovation. So innovation can only come from the places, where there are breeding grounds. And that could only happen if there is, if companies are thinking about inclusivity. Because if you are wondering whether what I say, is it gonna backfire me, or if there's no psychological safety, then, how will you innovate? So I think creativity and innovation are the other 2 factors. And then again, same source, HBR, also mentioned that there is 87% better decision-making. So the decisions that are made are very well-rounded because there is so much perspective that, comes in if people are all from maybe different countries or different ethnicities or, again, born and brought up in different states. Yeah. So in the US, if we think about just if for a second, let me take a step back. And if I'm not open to, welcoming other countries or other, people from other countries, maybe even if I just think about I'm hiring within the US and I hire people from different states who grew up in different states, it can be so diverse.
It's so important. And that's the breeding ground, like you said, for creation, for innovation. Like we need different ideas. We need people in the room that don't all look the same. Exactly. We need different people in the room. That's beautiful. Okay, I want to get into advice. Yes. I want to talk about some advice that somebody watching this is like, I love Nishtha. This is what I want to be. And they're 17 and they're on their bed and they're watching this interview. What advice do you have for them that they want to grow in the biotech world or the pharma world? What advice do you have for somebody that doesn't know if they could do it, but they have the passion for it?
Sure. So again, I want to maybe share 3 things here. Call it PCR. So, which is PCR is a scientific term used in laboratories. So I'll just call it PCR. So, where P stands for possibility. So it's very important for a person. And I would say, if you are younger and you want to grow in your career in biopharma or technology, it is very important that you believe in possibilities and believe that, it's going to happen. So because what happens is that we think that we attract what we want, but we attract who we are. So we never attract what we want.
That's good.
Yes. Yeah. Because we are literally, if we have done the inner work, everything is a reflection of what we are inside. So outside is a reflection of inside. So if, we believe in ourselves, then we are going to attract in believing. If we believe in possibilities, we believe in ourselves, we are going to attract possibilities. Because if we don't believe in it, then, we are not going to align ourselves with the universe to be able to do that. And the other thing I always think about is we only don't get the opportunities we don't ask for. So it's about, believing in yourself, believing in the possibilities, and asking for those, and basically attracting them by becoming what you want to attract.
Yes.
So that's number one, which is possibilities. Number two is C, which is comfort zone, which I think is enemy of all the progress. So I always, I would say that be ready always to step out of your comfort zone, because if you are in your comfort zone, again, life will feel amazing maybe for some folks, but then for some folks, it might not feel easy. You might feel, oh, I'm going through something. Why is life so easy? So I think stepping out of the comfort zone, what's going to happen is you're not going to like it, first of all, because there will be people coming to you with feedback. There will be changes happening across. So I think whenever things are not going the way you have expected them to be, maybe you are out of your comfort zone. So I think it's very, very important. And also comfort zone could mean changing, moving countries, moving cities. And I have actually moved to a different country, then I have moved within different cities. So I've always thought of, if there is a possibility and I'm attracting that possibility, it is not in my comfort zone, which means it's not in my 30-mile radius. Now I have to move somewhere in order for me to become that person. Then, just ready to embrace that you're going to be out of your comfort zone. It's going to be difficult, but let's, embrace that opportunity. So that's number 2, which is the comfort zone. And number 3 is relevance. So in this world of godlike technology, I would say we have to stay relevant. And how we can stay relevant is by being a student, and not just a student watching reels and thinking, I got it, watching TikTok videos and thinking, oh, I know so many things. But generally actually being like a student who is willing to always stay curious, always willing to learn. I mean, even though if you are at pinnacle of your career, you should still pretend you are a student, because you can still learn so much from your teams and your employees, even though they are not at the same level, but they can teach you so much. So by being student, what would happen is not only will you be respected, and also you will see all the perspectives around you, but then in the world now where we have technology evolving so fast and it's literally becoming godlike, we have to keep up with it. So and I'm not exactly sure which survey it was, but a survey quoted that every 2 years our skills we are out of. So any skill set you have is irrelevant.
After 2 years.
After every 2 years now. Again, in past, I would think it could be potentially 5 years, but now it's becoming every 2 years. And I'm not going to be surprised if we hear that every 6 months you need to skill up. So always, keep learning, growing, developing.
But we can understand how that could be discouraging, or kind of like, I'll never be able to catch up.
Yeah.
But you can't fall into that. You always have to be like, hey, I can always learn. I can always be better. I'm human, so I always bring a human element to things, which AI can never take over.
Exactly.
We have to keep that in mind. There's certain things that AI just can't take. We need us for. Yes, that's so important.
Yeah. I mean, even if our technology is godlike, it cannot replace humanity. No way, because we created that.
Right. We did it.
We are adding fuel to it to like replicate in that way. So think of like a bacteria, like in a lab, we culture it to help it replicate. So it's just like that we are, and I'm not saying technology is bacteria, but we are feeding into it for it to grow this way. So it's created by humans. We have created it. So I totally agree with that. So just to, share my advice for people who are young and who want to, who are curious how they can become leaders. There is an advice where it's a PCR model where you embrace the possibilities and look for possibilities, step out of your comfort zone and be relevant.
That's a perfect response. Let's talk about the future.
Yeah.
looking forward, what excites you about biopharma, about, well, you could go any route with this, biopharma as a whole, or its alignment with AI and technology, about what excites you?
So I personally am very excited about the possibility of personalized medicines. So yeah, so just to give some ideas there, essentially now we have so much data. So we are collecting data from our wearable devices. We have data in our EMR records. When we go to doctor, we have again our data through our phones. So all that data is now being collected, and that together with your, say, blood samples and pretty much your genetic data could eventually, create medicines that are personalized for you. So which would mean is that based on Nishtha's genetics or her blood work and her family history, she could potentially get this XY disease in future. So I wouldn't say we are like right at the personalized medication, but then there are a lot of programs that we are already seeing where at least by there are these segregated groups who are collecting all your blood work. And essentially what they would do is they'll check for all the biomarkers, and they can tell you that in maybe 5 years you are prone to getting this disease, or in 10 years you're gonna get that disease. So which would help me get the treatment which is tailored to me. And so I think I'm very excited about that. And I also think that's where it's very important to think about, women and a lot of, groups that do not have that data. So again, a lot of medications that are made, they are not equal because, maybe something for headache that works for me may work for general 80% of the population, but, may not work for you. So I think that's interesting to see, but that's what I'm excited about because it will not only help me get that right like medicine for me, but also for, say, a set of population personalized to them, where I could not only take care of my health today, but I could avoid a lot of things in future. Yeah.
I never even thought of how personalized medicine can become in the future. Like, not just I'm helping everyone with type 1 diabetes, but no, Nishtha has type 1 diabetes and a history of XYZ and a history of ABC. So now I can build this specific drug for her.
Yes.
And then if there's somebody else along the line that has that same build up, then sure, we can give it to them as well. But this is built for Nishtha.
Exactly. And for the kids who are just, like young children, it can actually be life-saving, and we could avoid so many diseases. We could save so many lives this way. So yeah, so that's area in I would say not biopharma, I would say medicine that I'm excited about. But the other area that I'm really excited about is, of course, AI. So so we have again AI agents now that are sort of taking away some of our very boring day-to-day tasks. So even I would say now a lot of emails that I receive sometimes are from AI agents. So for example, I will get an email from Cass's personal assistant to say, hi, I'm assistant to Cass. Are you available at this time? So again, you could automate a lot of what you do through these agents. So I'm really excited to see, again, these are semi-autonomous, so they still need human in loop. But then there is agentic AI, which is going to be agents operating on their own, which again, I'm a little bit scared about it, but I'm also excited to see how that would work. So I think if you ask me on technology side, it's just where AI will be end of this year.
Yes. And it grows literally end of this year because it grows so rapidly.
Yes.
Like, we're able to grow it so rapidly, which is beautiful.
Yeah. And then there have been so many new trends. So we have Ghibli trend in AI.
Ghibli?
So if you upload your image on ChatGPT, ask it to convert it into Ghibli image, you will get like these Japanese anime kind of images with like...
Really?
Yeah. So that's number one thing to try now. There's another trend that's going on where you upload, where you, I think, give it a prompt and you ask it for an action figure and you ask it for things you like. So it like creates an action figure in your name with you in the center, like a doll. and then what things you like. So like literally like in a package of a doll that you
Oh my God.
somebody. It's just every week I'm seeing a new trend.
That is so cool. I need to dive down into ChatGPT more because like we've created this program that could do almost anything. Like godlike. Like
Yes.
but also scary because it's godlike.
It's scary. And just as of yesterday, now ChatGPT is remembering everything. So unless you turn it off, if say 10 days ago, I prompted it about something, it's remembering it. Because just this morning before coming here, I was just trying to upload, some of this and trying to ask some questions. And it was just telling me things from 10 days ago. And I was like, where is this coming from? And then I quickly Googled and I checked that it was since yesterday, it has been all over the news that it's remembering things.
Wow.
So yeah, we want to be careful because we know there are certain things we may not wanted to remember. Literally. And again, if we wanted to remember our preferences, great. That, I'm allergic to this and I don't like this. I mean, great. And then, you are asking it to create you recipes and things like that. But then there are so many things you may not want it to remember because it may hallucinate it into the new information.
Right.
Yeah.
Exactly. It might implement it. And it like this now new topic has nothing to do with that old one. Now, okay. Wow. That's it. Look at innovation. This is insane. I want to know where people can find you.
Yeah, so I am, people can connect with me on LinkedIn. Just search my name. And I work for Takeda, so you should be able to find me.
Yes. Perfect. And then, okay, so we're going to roll before we roll right into my last question.
Yes.
I want to ask you if there's anything else that you'd like to share with us in regards to biopharma, medicine, Takeda, anything else?
So it's a completely different thing. So I'm actually speaking on a TED Talk in summer this year.
Is this your first TED Talk?
Yes.
Oh my goodness. Where is it being filmed? Do you know yet?
Yeah. So it's going to be in TEDx Andover.
Okay.
So this is going to be my first TED Talk. And what I'm speaking about is, again, because I live and breathe technology, I'm talking about, social media and how, technology should work. We should be using the technology and not the other way around.
Don't let it use us, but we should be using it.
Exactly. So it'll be talking about, how social media has made us so addictive. And again, how we could, think differently and take an approach where we are constantly not letting technology use us, but we are using the technology. So I'll be talking about some neuroscience, some techniques of, how we could potentially bring up the balanced approach, and also how these technologies lack digital labels.
Nishtha, I want to come. Can I come to your TED Talk?
Please.
Yes, I definitely want to come. I've never been to one. I think that'd be so cool.
It's close. I think not that
far at all. And not even just cool. I've never been to one, but I said this before. I'm really excited, and I don't feel like this. Well, I shouldn't say that, but I'm really excited about rewatching this conversation.
Me too.
Not even just the passion. You know so much. I would love to come to your TED Talk. I'm gonna definitely try. Oh, that's great.
Yeah,
I'm so happy for you.
Yeah.
Okay, now we can roll into my last question. So I asked this question to all my guests. I created this platform for people to learn. I want people to just learn, and I want to learn. I want them to learn about the world, about new industries, about themselves, all that stuff. So my question to you is, what is one thing that you wish more people knew? And this could have to do with biopharma, medicine, just yourself, the world in general. What's something that you wish more people knew?
Sure. So when I think about this question, I always think about, and again, this is something which makes us more human, which makes us unique. It's emotional intelligence. And emotional intelligence, again, I have met so many people where, they are so accomplished, but they are not self-aware. So I think there are, components to emotional intelligence, one of which is self-awareness. And if you are not self-aware, you have no idea what impact you are having on others. So, and I totally understand that some people journey that, sometimes they never had time to think about these things or reflect on it. But self-awareness, then there is self-regulation. A lot of times people, are unable to regulate their emotion, the impact others are having on them. And again, I understand all of us are work in progress in a way, and emotional regulation is not something, we are all taught. It's something we have to learn. Again, with self-awareness comes regulating your emotions to be as effective as you can. But I think the main thing which I feel like is the core of emotional intelligence, empathy. So it's the ability for, for us to be able to empathize with other, put yourself in other person's shoes and actually look through their lens in the world. So, I think these are sort of the things that actually make us unique. Even though we can build models, we can build algorithms, we can train as much as AI as we can, but a machine can never have emotional intelligence. So emotional intelligence is still one place or area where I think it will always remain unique to a human. But just I think all these things, which is self-awareness, self-regulation and empathy, could actually change how we show up in our relationships, our partnerships, our friendships, and at work, and again, what we do. So again, I think that's something I truly think can help. Sort of, particularly if you ask me what is one thing that I would want people around the world to think about or reflect on, that would be it.
That's a great answer. That affects your emotional intelligence, affects so many different platforms of your life. And like you said, not all of us know, not all of us can detect our emotions, not all of us. But once you begin to, then you begin to see the world a little differently, and you begin to understand how you affect the world.
Exactly. And then, couple that with your why, as to if you're doing something, maybe ask yourself that, why am I doing this?
Yeah.
So I think if you can have both of those things connected, I certainly think even, we can have God-like technology, we could have anything, but it could not replace humans.
Yes, that's so true. That's what makes us human. That's what's so important. Nishtha, I could listen to you talk all day. I could literally, I just feel like I'm learning so much. So I need to say thank you. Thank you for spending your time with us. Thank you for coming here. Thank you for sharing your story. I'm really excited for your tech talk. I'm really excited for you. All right, we're going to close out. Thank you for watching if you watched. Thank you for listening if you listened. You can catch Through with a Splash of Tea every Wednesday and Thursday on all streaming platforms. Bye now.